Um, we can start with what they call normal aging, and this is a very important statement that aging is an inevitable process in human existence. That means everybody is growing old as time goes on. And it is what people should understand that as soon as you're born, the aging process starts. So if I come back here, so geriatric psychiatry is about the prevention and treatment or care of diseases that affect the mental health aspect of people who are older. So there is a nomenclature process. Some people use the word elder or elder people, and the others don't like the use of that word. They think someone who is elderly is somebody who is extremely very old, is very weak, and cannot support themselves. So many platforms that deal with the older people don't want the word elderly. So they prefer the word older persons. That when you say older persons, it is not stigmatizing. So I think for us, we can use that. It's being used by the World Alzheimer's Association. They talk about older persons. So let's use older persons so that we then say geriatric psychiatry is the treatment and prevention of psychiatric disorders among older persons. We shall come later on a definition. Who is an older person? What's the cutoff point for an older person? Okay, so there is normal aging, and it is associated with you become weaker as time goes on. There is change in the brain, especially the weight, as time goes on. And even the behavior, our behaviors also change as we grow. And there are social and psychological issues that come along. But growing old is not a disease. It is an inevitable part of human life. Okay? So, this is a human cycle. Maybe you have already seen it. You probably learned, not probably, you learned about embryology from fertilization for the 9 months when a fetus is growing. So that is the earliest that we have in the human cycle. From there, you become a baby. And in the pediatrics, we learned how babies, there are milestones for babies. You know, they start to sit and eventually walk and run and things like that. And then they pick language, then they become children, okay? And for Uganda, up to the age of 18, you're a child. After 18, you are not a child, but you can progress to adolescence. But also some adolescents are children. But the key thing now is between an adolescent and a child, you become an adult. So the whole of this class, I am sure, are adults. Is there anybody who is less than 18 years in this class? Yes. Less than 18 years? Do we have anybody less than 18 years in this class? Yes.
Doctor, we don't have.
Who is that one who is less than 18 in the medical school in the 4th year?
This lady is lying.
So the ladies are lying, yeah?
Yes.
Yeah. Okay. So now, between adulthood, from adulthood, you go to old age, which is now the focus of today's discussion. Now, at what age do we say somebody has transitioned from adulthood to old age? Um, some people think that in the developing world like Uganda, it should be 60. And then in the developed world, like the US, Europe, and so on, it should be 65. And the people in the developed world are not agreeing with that type of thing. Why do you segregate? Well, because even people in the developing world can live long. So generally, the cutoff age for old age, so say these are older persons, is taken conventionally at 65 years. And many countries use 65 to be the age for retirement when you're working. When you reach 65, then you retire. So you can no longer be employed formally. You go and do some other things. But remember, between being an adult and old age is not like moving from one district to another, where I know when I cross this river, I am now in another district. It's a smooth process, and you don't notice an immediate change because the aging of a human being is extremely slow, and so it's so gradual. So it is not like you are going to move from this and immediately go to become an old person and everything changes all of a sudden. So that is not true. So then, of course, the last part of the cycle is passing on to the next world, and that is death, and that is inevitable for all human beings. Some people believe, I am sure there is a good number in this group, that when you die on earth, you go and live. Either, if you are not well behaved on earth, you go to hell. But if you're behaving well and you are born again, you go to heaven. But we don't know that bit. It's subject to people's beliefs. But here on earth, the last part you play is death. And then the cycle continues with your children and things like that. So I thought I would show you this cycle so that you know that you passed some stages already. You are an adult, but ultimately you'll transition to old age. Okay? So it's a cycle. Now, this is about the aging brain. Is there anybody who wants to tell us what is the normal weight of an adult human brain? A young adult. How many grams? How many grams is an adult brain? Yes? Hello? Are you guys awake or you have slept? Huh?
Yeah, it is 1.3 to 1.4 kg.
Okay. So an average of 1.5 kilograms. That is the weight of the brain of a human being. So you can mute yourself. I'm getting echoes. So as time goes, the weight of your brain goes down by these percentages you're seeing. So between 30 and 70, 5%. By the time you reach 80, you have lost 10%. By the time you reach 90, you have lost 20%. So it has an effect on the mental health of the what? Of the person. Because remember, the things to do with mental health have to do with the brain. Okay. Then I also thought I would share with you the age structure for Uganda. This is 2020, and the age group we are concerned about, the older persons, is 65 years and above. And currently in Uganda, these are about 2% of the population is aged 65 and above. So I don't know how many people these ones are. Anybody who can compute quickly? 2% of 40 million is how many people? Yes?
8 million. 8 million.
2%. 2 divided by 100 times 40 million. Can't be that. Recalculate.
800,000 people.
Yeah, 800,000 people, almost 1 million people, isn't it? Okay. And our population pyramid then looks like that, because in Uganda, at the moment, the population is very young. So 15 years and below are taking a half of the population. Okay. So if you look at below 65, we're talking about maybe 39 million. However, in UK, the United Kingdom, 17% of the population is 65 years and above. So as time goes on in Uganda, we are going to reach a point. We are going to reach a point where the elderly population is so big. So knowledge of managing people who are older persons then becomes very critical. And that's why for mental health, this lecture is very important. Okay, so can I get from you what roles, maybe, I wonder, you probably still have grandparents, I'm sure. Okay? So what roles do older people play in Uganda? Let me just get examples. You can unmute, say something, and then mute again.
I think they give advice.
So the older persons in our country are a very good source of advice to younger people. Okay? Anything else?
They work in political offices like Museveni and the others.
I agree. So in the cabinet and in parliament, and even in the in other political offices, there are certainly people who are 65 years and above, and the president is an example. And there are others like Moses Ali. We have Magode Ikuya of recent, and others. So there are a good number of there. So political offices. Any other? Hello?
They teach us about our heritage.
Okay, so they are the custodians of knowledge about our heritage. They tell you those days things were like that, and they can pass on that knowledge. Okay, so the first bullet you see is that the older persons are commonly carers of orphans and other vulnerable children. And this was much more true when AIDS was a real problem in the country. So when the young people die, the older persons take over. They're looking after children. If a medical student got pregnant, she might take her baby either to her mother or to her grandmother. Okay? And they'll do that. So they provide that care. But also cohesion in society, keeping societies together. In communities, when there's an older person, everybody, respects them, and so they may not want to cause chaos because of respect of that person who is there, the grandfather, the judge. And when things go wrong, they bring in their knowledge to resolve conflicts. For instance, boundaries, they know that no, the boundary between you and you was here, okay? Then you mentioned this one, they are the custodians of our knowledge and values, and they pass this through generations. Some of them are working and can create wealth if they've been in business, and so they can be over 65 and they can still work. A good number are involved in traditional medicine because they know which plants work, and so on. And then that last one, the political leadership, and you gave examples. So the older persons play that role. Now, older persons have got a mix of both physical and mental problems. So before we come to the mental problem, but let's first see which physical health issues do you see among the elderly that are of a big concern, that this is really common in people who are old. Can we get quick examples of such conditions?
Malignancies like cancer.
Yeah, there are certain cancers which affect the older people more than the young ones, so that is very true. So oncological conditions, any other?
Huntington's chorea.
Okay, so there are neurological disorders like Huntington's chorea, or Parkinson's disease, which you really are not going to get in young persons unless you are using neuroleptics. Okay, any other?
Dementia and osteoporosis.
Okay, so dementia, we're going to get that as a mental health issue, but certainly osteoporosis is one of them, especially in women. So they end up with the pathological fractures. Fractured neck of femur is very common in women. Yes, any other? So,
Diabetes.
Come again.
Diabetes mellitus.
Yes, so non-communicable diseases like diabetes, hypertension, okay, problems of sight, because older people get cataracts. They have problems in the hearing. As people grow very old, hearing becomes a problem. They have joint pains. You probably have seen this in surgery, in OPD. So the arthritis is a big thing. It can affect the joints in the limbs or the back, okay, and loss of muscle bulk. So the physical problems are so many. How about the social problems? Can you name some?
Poverty for those who did not save when young.
They don't have what?
Friends.
So isolation, So your social capital goes down, because also your friends, because now, for example, for us who work in university, you have a staffing of about 400 people. So most of them know you and you know them. So you are connected like that. But eventually, when you retire and go back to your village or your home, you no longer have these people. And even if they are there, they're also very old. So many times you are left alone. And as the country urbanizes, you find that the children you are working very hard to take to school have gotten jobs and they are no longer there. So you become isolated. Then there is what they call the empty net syndrome. A bird has eggs in the nest, but when the chicks hatch and fly away, the net remains empty. So also we go through that as a social problem. because your children will get married, the ladies will go, the men will also get their wives and go away. So all of a sudden, you find that the 4-bedroom the house has only you and your wife. So you're just the two of you. So you remain alone, and it's a big problem. Yes, so true. Social isolation is one. Any other?
Poverty, as some are not working and they did not save well for their old age, so some can be poor.
Very, very true. Yeah, so these days the computer is a very good tool for us. So when you're entering public service, it has your date of birth, and they fix that this year in this month you will have to retire. So the income stops, and all of a sudden you are not earning. And so, as you have said, if you didn't save, so poverty becomes a big problem. So, and it's a huge social issue among people who are elderly. Yes, any other?
Stigma and discrimination because they are old and associated with them.
Exactly, especially in young population like Uganda. So the young ones look at the very old ones like you are just consuming resources. What are you still doing in an office or something like that? So yes, the older persons are stigmatized by the younger people. Okay. So any other example?
Yes, they can also suffer from abuse.
Yes, the elderly abuse is a real issue. We have studied the prevalence of elderly abuse, the elders who seek care in the hospital, and we're really finding that 1 in 4 older persons have been abused by close relatives over the past 1 month. So older persons abuse is a real issue. So yes. So there are other things like loss of jobs. Okay, retirement, which we already alluded, that leads to poverty. So retirement is a life changing experience, and there is a time when civil servants were retrenched. Retrenchment means you are forced to go out, okay, and they give you some money and you go. So about a quarter of that population did not live for more than 1 year. They just died. Not all of them were older persons, but some of them were a little bit younger. So retirement is a real issue. So it needs proper planning so that you know where to go. Things to do with the housing that we haven't mentioned yet, but in communities, people who are older persons some of them have a problem with accommodation because now you don't have the energy to make your own house, like in a village where you construct your own house. So it becomes a problem. So there are social circumstances, psychological, put your declining cognition. You are no longer as sharp as before. So it affects your what? Your mind. Okay. So psychiatric conditions among the older persons is common. This is a study which was done in Mlago and published. So you have come across depression. We're also going to look at it. So almost 1 in 5 of the people who are admitted to non-psychiatric wards, these are general wards, surgery, medicine, gyne ward, okay, 18%. Then adjustment disorder, this follows some stressor. Dementia, we talked about that. Older persons have problems of sleep, problems of delirium, anxiety, delusional disorder, then substance use, including alcohol, and then nicotine. So you can see from this research that older persons in Uganda are suffering from psychiatric disorders. And if you look at those who did not have any, were 52%. So about a half of the people who are admitted in general wards in Mulago Hospital had some form of psychiatric disorder, depression being the commonest. So then it calls us to be aware that older persons have a high risk of developing what? Psychiatric disorders. So we're going to look at a few examples of psychiatric disorders among the older persons, okay? So what predisposes? So this is delirium. I think you all know delirium as an acute psychiatric disorder that develops within hours or days, and the cognition of the person is impaired, okay? And by cognition, we mean orientation in place, person, and time, attention and concentration, and then memory. So that is impaired in people who have delirium. Then, of course, even sleep is disturbed. They may be having a wandering behavior, wanting to run away. They can even be having hallucinations. So delirium is a common disorder among the elderly, and if they have pre-existing dementia, defective hearing. So I want you to take note of defective hearing and vision, because this can be corrected. Defective hearing, you have been to ENT clinic, I think, and wax in the ears is one of the reasons why people don't hear properly. And when you don't hear properly, you are disposed to delirium. And then also, if you are not seeing clearly, for in which case, if it's a cataract, it requires an operation. But if the older you are, the higher the risk, but we can't change the age, okay? Or if you have Parkinson's disease, it can be treated. So, vision and hearing are amenable to prevention, because if you can detect that, you can do something. Then, the precipitants are infections, which are again very common in this age group. Urinary tract infections are common because these patients may actually be having problems of passing urine. So it's likely to be infected, or they may be having a catheter for men, especially in men. So getting a urinary tract infection among the older persons is very easy, and it can put them into delirium, even if it is a slight infection. And then strokes is the other one. You've probably seen this in medical ward, but people who suffer stroke also have the what? The high prevalence of delirium. And then the toxic effects of medicines. Now, as doctors in training, I really want you to be wary of number one, polypharmacy. That means giving people so many medicines. So I have malaria. You give me an anti-malarial, you don't give me a painkiller, maybe paracetamol, you're going to add a multivitamin there, that's for malaria. But again, I'm also taking medicine for hypertension, and I am also getting insulin or tablets for diabetes. So in the end, I end with 10 medications. So you're likely to make someone get delirium, and this is very common. Number two are very high dosages of medicines. In psychiatry, I'm going to repeat this later, we want to use a quarter of what I would use in the younger people when we're giving dosages. So to help us with delirium among the older persons, use the lowest dosages of medicines you can, and use as few medications as you can, to only keep those which are very important. So when we're managing delirium, in the elderly, like we do delirium in the other populations, look for and treat the cause if it is treatable. So treat the infection, deal with the polypharmacy and the high dosages. If it is alcohol, you must address that in that line. So that is how you manage. And you can add a small dose of haloperidol. So I recommend use 0.25 milligrams of haloperidol. So if it's a tablet of 5 milligrams, you can use a half of the tablet. You can even use 1.25 because that's a quarter of the tablet. And it can help to correct the what? To correct the symptoms of delirium. So a very, very small dose of haloperidol. Chlorpromazine is not good because it causes orthostatic hypotension. That means when the old person stands up, the blood pressure drops so much and the person falls down. So we don't encourage the use of chlorpromazine in older persons. So you can use haloperidol or stelazine. One of those, it works. So that's delirium. Then dementia, which you already talked about. There's a separate lecture for dementia, so I'm not going to give details here. But the commonest form of dementia is Alzheimer's dementia. Alzheimer's dementia. And I think it accounts for 3/4 of dementias in old age. And of course, the key disturbance in dementia is memory. Then the other dementia is the vascular type. Okay, and this one, the person is predisposed because of hypertension, especially which is not treated. So there are microinfarcts that affect the brain, and eventually the person develops dementia. Then there are dementia due to other causes: Parkinson's disease, neoplasms, infections, toxins, substance use, and so on. And some of these can be reversed. Like if it is due to lack of vitamin B1, you can reverse it. If it is due to alcohol and the person stops, it could be reversed. Okay? So dementia is a big issue. As the population ages, the cases of dementia increase as time goes. So when we have a separate lecture for dementia, then we shall learn that there are some medications like donepezil that are used to slow down, say, Alzheimer's dementia. But out is the person deteriorates over a period of 10 years and until eventually the end of the other cycle that we talked about comes in. But the key thing is we should be able to screen for dementia by doing an assessment of the cognition and testing for memory. Immediate recall, short term and long term. So then if you suspect it's dementia, then you can use a mini mental status examination to look at the other aspects. So dementia in the elderly is a big problem. At Mbarara in the psychiatry ward, every month we see maybe 2 or 3 patients with dementia in the ward. So it's an issue. So we shall have details when we talk about dementia itself. Then mood disorders. Mood disorders can either be an elevated mood, which is a mania. Let's start with depressive disorders in the elderly. They are quite common in among the people who are older and certainly more than the people who are younger. And suicide is much associated with the people who are depressed and are old. They are those who just opt to take their life. So the symptoms of depression in the elderly are really the same as those who are in the other age groups. So Anybody to remind us the key symptoms of depression, what we think are key, what you must have to diagnose depression. So what are those symptoms? 1 and 2. What are the key symptoms of depression? I'm hoping that people are still awake.
Anhedonia.
Anhedonia, loss of interest, eh? Yes. So anhedonia is the extreme loss of interest in things that the person used to enjoy before. So true, anhedonia or loss of interest in things that someone used to enjoy before is a key symptom of depression. What is the other one?
Low mood.
The low mood, yes. Persistent low mood for over a period of 2 weeks. So that becomes another key symptom of depression. So then what are the other associated symptoms of depression?
Is a feeling of worthlessness.
Yes, feeling of worthlessness that can make you commit suicide. Any other?
Lack of sleep or excessive sleepiness.
Yes, poor sleep, that you don't fall asleep at all. Or if you are sleeping, you have very bad dreams. But there are others who might sleep too much and they don't get out of bed when they are depressed. Any other?
Either too much appetite or very little appetite.
Yes, really lose appetite completely. Yes, there were two people who are talking. One is saying appetite. What's the other one? The other person is saying
Reduced level of concentration.
yes, reduced level of concentration, and so they appear forgetful. And you might think they have dementia when actually they don't have. It's just that they can't remember things because of lack of attention and concentration. Yes, another symptom. Suicidal ideations, or even they can go ahead and commit suicide. Correct? Any other?
Yes, there's psychomotor agitation or retardation.
Yes, there's a psychomotor retardation, so moving slowly and thinking slowly. Okay? And physical symptoms like they have a fever and the temperature is not high. Okay? So, among the elderly, there's dementia, which is prominent, then severe retardation and physical symptoms. So those ones are more prominent in people who are what? Who are older persons, on top of what we have already talked about. So how do we treat depression? Medically, pharmacologically, how do we treat depression?
Give mood stabilizers.
Mood stabilizers. Okay, if it is bipolar affective disorder, depressed phase, we can use mood stabilizers. If it is major depression, what do we use?
We give stimulants.
You give stimulants, okay?
Yes, like selective serotonin reuptake inhibitors.
Yes, we don't call them stimulants. What do we call them?
They are called antidepressants.
Yes. You guys, is it a lockdown? You know, you don't have to be depressed when you're in a lockdown. So, yeah.
What's taking 7 years?
Yeah. So anyway, we use antidepressants. Can you give me examples of antidepressants? Amitriptyline. Another one?
Fluoxetine.
Fluoxetine. And another one?
Escitalopram.
You've heard of mipramine, eh?
Yes.
Yes. So you can choose a tricyclic antidepressant like mipramine, amitriptyline, but you can also use an SRI like fluoxetine. Okay? So if you can remember those three, it's not too bad. Mipramine, amitriptyline, and an SSRI like fluoxetine. Those are the commonest that we use. Okay? But you can also use ECT. What's ECT in full?
Electroconvulsive therapy?
Yes, electroconvulsive therapy. So it's good in people who are older and they are weak, and the side effects of the medications might be too much for them. So ECT has been found to work very well in the older persons, especially really 80, 90, and they are depressed. ECT is good. Okay. Then mania, I told you that the other mood condition is mania, which is like a disease of happiness. Okay. So even people who are older can develop mania. So what's the key symptom of mania? What are the key symptoms of mania? Hello? What are the key symptoms of mania?
Elevated mood for
Yes.
period of around 2 weeks.
Elevated mood and a period of what? Say the next time.
1 week.
1 week, yes, at least 1 week. Or less than 1 week if it is so serious that the patient has to be admitted. Yes. So elevated mood, any other? The mood can also be irritable. So those two are taken as key symptoms: irritable mood or an elevated mood for 1 week or less than 1 week if the person is so disruptive and needs to be admitted in the hospital. What are the other symptoms of mania? Let's just name like 5. Apart from the mood, which is irritable or elevated.
Increased goal-directed activity.
Yes, correct. Another one?
Decreased need for sleep.
Decreased need for sleep, yes. And yet when they wake up, they look so fresh, and they start running around and doing many things.
Flight of ideas.
Yes, flight of ideas. Talk about this, talk about that, talk about the other thing, but you can understand what they are saying, and having so many plans. Yes. Any other?
Talkativeness.
Yes, so you cannot manage. If you try to interrupt them, they are going to fight with you, and then they become irritable. Yes. So, mania can happen in people who are older, and the treatment of mania is mood stabilizers that someone already talked about. Give me 2 examples of mood stabilizers. Lithium carbonate, yes. Now the second one.
Valproate.
Yeah, sodium valproate or valproic acid. And another one, maybe a third one. Carbamazepine. Yes. So if you can remember those 3, so for mania we can use we use mood stabilizers, carbamazepine, sodium valproate, or lithium carbonate. But we add an antipsychotic in the beginning in case someone is disruptive. So remember we talked about haloperidol as our antipsychotic of choice. Okay. Then substance abuse. We discussed substance abuse already, I think. And there are those ones who carry on their drinking from a younger life, and they continue to old age. But there are also those who start at old age because of the isolation you talked about. They don't have much to do. So they start drinking. So alcohol is a commonest substance people drink. Beer, wine, spirits, and so on. Others are in Malwa groups. So the question here is the liver, which is the main organ for breaking down alcohol, has become weak as someone grows old. So they now need smaller amounts of alcohol to become drunk. But also the effects of alcohol on the body are so pronounced. So when you become an older person, it's really better not to drink. But if you don't want to live, you just need very small amounts of alcohol. So I will not go through in this lecture the effects of alcohol on the physical body or the mental health of the person. We went through this, but alcohol is associated with all kinds of diseases. We actually call it a great mimic of disease. So it is one of the problems among the elderly. Then elder abuse, you mentioned this. It can be physical. In other words, you're beaten, either with boxing, kicking, slapping. Someone can use a stick and beat you up, and that is horrible. Confinement is saying, no, you are not going to leave home. You're now too old to be seen in public. So they lock the older person in the room. So as I told you, we did a study on this, and what we found is really so bad. There's a lot of older persons abuse in our community, and it's something that we can address through education. Okay. Then schizophrenia, like and paranoid states. So when people reach a certain age, 60 and above, they become suspicious. Genuinely, sometimes because their vision and hearing are not okay, so they think people are becoming enemies. But even beyond that, they have that suspicious type of behavior. So it's a common state in people who are older, and they call it paraphrenia. So they become suspicious. So maybe you need to understand if you have your grandparents, and at a certain point they say that you are the one who ate the bananas which are kept, and you might not be the one, or they misplace something, and they think people are against them, and they want what? They want to harm them. But besides this, there are also people with schizophrenia who can live up to old age, and so they carry on with their psychotic states until when they reach old age. The management of schizophrenia-like and paranoid states is haloperidol. Again, as I said, those very, very low dosages of haloperidol. Okay. So I think that's the end. But I wanted to say that the government can put in programs to help the elderly, and I think they have started. There's what they call SGS, Senior Citizens Grant Scheme, or something like that. And they are giving older people 25,000 shillings per month, and it has really helped. But less that, grandchildren and children of older persons keep sustaining them and sending them money. And the older persons in Uganda are within communities, which is very good. If you are in the developed world and you're getting older and older, when you talk to the Americans and the British and the other guys from Europe who come to Mbarara, for example, their biggest worry is being taken to a nursing home. That means you can no longer live alone in the home, so they take you to a nursing home. Within our vicinity, there is a nursing home in southwestern Uganda. I think on Kabale Road there. It is faith-based. I don't have its name in my head right now, but what they are doing is they are providing social support to people who are old. Some are staying there if they don't have any upkeep in the communities, but others are brought to the home. They stay there, and then in the evening they are taken back to their homes. So that approach of keeping older persons within their homes and what is much better than taking them to nursing homes. But as our country urbanizes and we get more people in towns, things are going to change. Because like your age group now, by the time you reach your 40s and so on, I'm very sure that you probably have a house in town, and you and your wife are working. So leaving your grandfather at home might be very difficult. So you might prefer to take them to some facility. So those are things which are coming up, and as the world is changing. But however, managing older persons in case they have problems at home where they have lived for long is much better. Then from what I've talked, you need the skills to identify the psychiatric disorders we've talked about through history taking and mental status examination. But also don't forget that older persons also have a multitude of other physical problems. So if you see an older person in a psych ward, apart from the psychiatric issues, look for the physical problems as well. If you see an older person in the physical ward, say medical ward, you should also be aware that they may have a psychiatric problem, and you can also ask questions which are psychiatry related. So if you do that, then you're going to provide proper care. Then as time goes on in your career, I am alerting you that geriatric medicine is getting popular as the number of people who are growing old is increasing. So much as you want to be a pediatrician or obs and gyn and so on, it is not bad to become a geriatrician, because you're going to have people to look after. And some of them may have money which they have saved, or their children and grandchildren have money and they can treat them. So it's a specialty that you should read about and get interest in. Okay, so can I have some questions if they are there? Hello?
Yes, doctor, I have a question.
Please ask. Now you introduce yourself, then you ask the question.
Okay. I'm Miro Emmanuel.
Emmanuel, yes.
So, under which discipline does geriatrics fall? Is it in psychiatry, or it can also be under internal medicine?
Yes.
Which discipline does it fall?
Yeah, so at the moment, it depends on the condition which the person has. If you have depression and you're old and there's nothing else, it's a psychiatric problem. If you have a fracture, it's a problem of orthopedic surgery, like that. However, the trend is coming where the major disciplines will be internal medicine, obs and gyn, pediatrics and child health, surgery, and geriatric medicine as number 5. So as the number of older people increases, that is where it's going to be, so that you have that discipline on its own. So right now it is split depending on the condition the person has, but as time goes, it is going to become a discipline of its own. Okay, is there any other question? So if there is none, thank you very much. I'll meet you in another lecture which is going to come later on according to our timetable.
There's another question, doctor, before you
Okay,
go.
okay.
Why is it that old people are what? They have endondo, they are petty.
What is being petty?
They are easily annoyed.
they are easily annoyed.
Yes.
Yes.
It also part of the aging process.
Yeah, so as you grow old, your personality also changes. So some people may not want to be challenged by young people. So if you're a young person and you're beginning challenging, I can easily become irritable because I think I am so knowledgeable that I shouldn't be disturbed. So But I don't have research really to show that older people are petty and entondo or something like that. So that is your observation for now. But if it is true, then that is the reason. Okay? All right. So thank you very much. I will share the notes through the email of Florida. And then, yes.
Yes, I'm asking a question. Just need this one. Is there anyone slowing down aging or something like maybe those people exercise and something like that?
Yes. Yeah, that's a very pertinent question. So, first of all, the major contributor of aging slowly is genetics. If you are born to a family where there is longevity, your grandparents are staying to 100, 105, 91, you have a chance because genetically you're programmed like that. Then there are things in the environment that can help you. So healthy feeding is very important. So what we call fast foods today, the chips, the chaps, you know them, ice cream and things which are processed are known to accelerate aging. But foods which are not preserved, you know, and not fried with animal fats like that, and foods which are rich in vitamins and fruits are known to help. They have more antioxidants. And then red meat is not good for aging, but that red meat like from cows, beef, mutton, and then but white meat like from rabbits, fish, pork is controversial because it is white, but it also has a lot of fats. Is better. Okay, so foods which have antioxidants are better, and then those other foods which are a lot of fats and red meat are not good. Then of course exercise is really very important. When you exercise, the risk of CVDs is lower. The risk of dementia is known to be lower, especially if you exercise in middle age. You don't begin exercising late. It's very good. It slows down aging. But also, even if you are an older person, you need to be intellectually engaged. It's very good. So even if you are an older person, but you can teach, you can be in meetings, you can engage in something that is intellectual. You know, it slows down the aging process rather than being redundant. So yes, there are certain things you can do, but there are others which are genetic that you might not alter.
Thank you, Professor.
Okay. All right, so we can end here and thank you. And do you have another lecture?
Done for today.
Oh, I've not seen messages in the chat. Are there questions in the chat which I should have answered?
No, there are no questions.
Okay. All right. Thank you. Bye-bye.
Bye bye.